Okay, we're gonna get started. I appreciate you guys all for coming in this morning. We have a lot to cover. Exciting changes are coming. Paylocity, as you guys all know, if you guys have questions about Paylocity, make sure you guys come see me. Registration emails for Paylocity are going out today, so watch for that. And then I have, we'll be sending out more information throughout the weeks and more training videos for it as we get used to it. Not all information is in Paylocity yet, and if you see something that's wrong, let me know, because it is all being reviewed right now, and human error might miss something, but watch for it. That's what we need you guys to do just as much as we do. That will be going into effect for payroll May 13th then. Some of you guys are already using it. But yeah, let me know if you guys have questions, concerns about Paylocity in general. You can talk to me after this meeting. We have a full slate today with Tony from 5G who'll be going over our health insurance. We have some people from health insurance reps. We have our Colonial rep, along with a new wellness initiative from Frio. So I would like to get started. Thank you guys for coming, and Tony will get us started.
Yeah, thank you. So yeah, Tony Gable with 5G Benefits. Everyone has this sheet. I'm going to kind of reference this sheet quite a bit today, and just kind of go over all the benefits. So I know you are switching to Paylocity, but for this year, all the benefits are still going to be just be done with a carrier enrollment form and then this benefit menu. Okay, so in the future, the plan is to put all the benefits onto that Paylocity system. Hopefully that's the plan for next open enrollment. For this year, we're just going to do what we've pretty much been doing. Is, you know, if you have a change that you want to make, you want to add somebody, you now want to delete somebody, you can notify Holly, and she will get that over to the carriers. So you're also collecting the Anthem forms. You don't need, you want the paper forms for Anthem, or we can do it in a census. Yeah, census for all that stuff. So this will be the main election form that you will use to make your elections. One thing to just keep in mind, if it's something that you're new, let's say you now want to add that you weren't on it before, just make a little asterisk, say new onto that, just to help her like flag it. Otherwise, you know, she'll have to make a change on that website to do that. So health insurance wise, you'll see on here, we actually are moving from WPS to a new carrier called Anthem. I'm sure you've heard of Anthem before. So previously we had two different networks within WPS. We had WPS and then the old Arise plan. So Arise was, you know, a smaller network. It took out Freighter. It was basically, you know, Aurora, ProHealth, a little bit smaller network than that. We're doing a little bit different where we're doing just one plan, and we're going with their Blue Preferred network, and I'll let Marlene from Anthem talk a little bit more about Anthem specifically, but the network of providers is huge. That was one key thing that they wanted to keep here at EH Wolf. They wanted to keep the provider networks and not make people forced to not have their doctors. So the Anthem Blue Preferred network, you're going to have Aurora, you're going to have Freighter, you're going to have Children's, you're going to have UW, Ascension, you know, Columbia State, Columbia Wheaton. All of those are going to be in that network. So it's a huge network of providers, national network of providers, and I'll let Marlene talk a little bit more on that. Now, the plan design itself is also very, very similar to what we had prior with WPS. So we're still going to be doing that health reimbursement account, that HRA. So I'm sure people are used to that by now, but I'll just kind of go over what that is that the plan itself that we're buying from Anthem is for a single is a $3,500 deductible, and then it basically is an 80% co-insurance after that deductible's met. So that means that you pay the first $3,500, then Anthem pays 80%, you pay 20% to a max out of pocket of $6,650. Now that's the plan that we're buying from Anthem. What EH Wolf is doing is they're beefing that up with what's called a health reimbursement arrangement account. So you'll see on the second tier on this is it'll say HRA. So basically what this means is that this is what you actually see for coverage. So even though we're buying that $3,500 deductible from Anthem, we're going to be lowering that deductible by EH Wolf paying for part of those claims for you. Okay, so we have a partnership with, it's called Employee Benefits Corporation. We've been using them for the last year, where basically what that means is you pay the first $1,450, then EH Wolf pays the next, what does it end up being, $2,050. That would equal your $3,500 deductible, and then after that, then it's an 80-20 between Anthem and you as the employee up until the max out of pocket. So just know is, hey, what's my deductible in the eyes of the insurance? If you were to call Anthem, what's my deductible? They're going to say $3,500, but we have this internal agreement where E.H. Wolf is essentially paying those claims to buy that down for you. So your actual out-of-pocket and that you have to pay first is the first $1,450, then 100% is paid for by E.H. Wolf, then it's 80-20 between Anthem and you as the employee. Now what's nice with this plan is that actually as of June 1st, Anthem has a partnership with Employee Benefits Corporation that you don't have to submit anything to get reimbursed. You'll go in, show your insurance card. Now one thing I do want to say is that it's brand new for them, that partnership with EBC, and EBC is Employee Benefits Corporation. So I know there could be a little bit of time delay. They're saying that they're getting it set up. We've had a few. We were actually one of the first, well, the first agency, I think, that set it up with the other partner that they had. And it did take a little bit of time, so just if you're not seeing your check instantly as of June 1st, just know that it's going to come. They're working through that, and we also have the carrier change. So just know that you're going to have that seamless where you don't have to submit anything to get that reimbursed. Okay, so $1,450 you pay, then E.H. Wolf pays the next 100%. Up until your deductible of $3,500, then it's 80-20. Now on a family plan, you'll see it's just twice. So your deductible is $7,000. So when I say family, that's employee spouse, that's employee kids, that's a full family. So you plus 1 or you plus 10. It's just double the deductible, and then you basically you pay for that plan as you pay the first $2,900. Then it's 100% paid for. In the HRA up until you hit your deductible, which it gets a little complicated here, but if it's one person in the family that has all of the claims, you pay the first $2,900, then the HRA will pay 100% up until your deductible. Well, one person in the family only has to technically hit $3,500 from Anthem. Okay, so that's actually a good thing. So you hit $3,500, then it goes 80-20. Okay, so now let's just say 2 people in the family hit it. So 2 people both have claims. The most you'll pay is the first $2,900. Then all of the bills in the HRA will be paid 100% up until your $7,000 family deductible. Then it goes 80-20 between you and Anthem. Just know a couple things. One is the most that you can pay from one person in the family from the Anthem side is $3,500, and then you're out of pocket of the $6,650. You can see there. And then the most that you can pay of your total family is a $7,000 plus E.H. Wolf's paying part of that, right? Up until the max out of pocket of $13,300, but E.H. Wolf's paying part of that. Okay, so it gets a little confusing when you have, who's kind of hitting it first. Just know, hey, if I'm a single, I'm paying the first $1,450, then it's paid for by E.H. Wolf, then Anthem kicks in with me. If I'm a family, I pay the first $2,900, then E.H. Wolf pays in the HRA up into how many claims you had, and then it gets split by Anthem. Okay, so that's how the plan works. The other thing that to keep in mind is that all of the benefits that we're talking about today renew on June 1st. So our renewal date is June 1st. If you're a new employee, there's a waiting period of 60 days from date of hire to be able to come on to the benefits. But if anyone who's currently an employee, June 1st, that's when we're switching it. Everything's just going to roll over for you. Your deductible starts over January 1st. Okay, so what the heck is June 1st? June 1st is just when your benefits are going to renew. So that's when they renew, that's when the rates change, that's when you can come on or off the benefits. But your deductible starts over on January 1st. That's very common out there, is deductible starts over January 1st. The other thing that we are adding this year is we have a spousal surcharge that we're adding. We're just keeping in touch with pretty much most employers out there are doing that. A lot of them are actually going to spousal waivers, where if your spouse is offered insurance, you can't come on this plan at all. That's not what we're doing here. We're actually doing a spousal surcharge. So if, let's say your spouse works and they want to come on this benefit plan, there'll be a rate for spouses, but if your spouse works and has offered from their employer, it would be an extra $100 a month for your spouse to take this plan, but they can still take the plan. So it's kind of in the middle, meet in the middle. You can still take the plan. Okay, so makes sense on the health reimbursement account. We're going to also have a video. We call it a video vault, a 5G video vault. That'll be videos explaining the benefits a little bit more if you want to go in depth on that a little bit more as well. But I'm going to actually have Marlene come on up, and we'll have you talk through the Anthem side of things, just about a little bit more of the value adds, options on that stuff. Preventative care is still 100%, all of that stuff. All right.
Down here. Lost my spot now. Perfect. I can't get down to this. All right, thanks everybody for coming out this morning. And like Tony said, I'm with Anthem Blue Cross Blue Shield, so it's a common name. 1 in 3 members in the country that are covered with insurance are Anthem members. But I'm going to start bringing you through this booklet. So we're just going to talk through some of the value adds that we have here at Anthem. We're going to first talk about the network that we have. Tony covered a lot of that. But I'm starting on page 25, and it's this map of Wisconsin. So Tony talked about the Blue Preferred Network, which is the broad Anthem network in the state of Wisconsin. And that network does have coverage through all of the major health systems in the state of Wisconsin. So you're not going to find a more broad network with any other carrier. We do include so Dean Health down in the Madison area. We have a UW system. We've got Freighter. So all of those provider systems are going to be in network. But we do always recommend that if you have a provider that you're looking at, especially if it's a specialist, that you do check to see that that provider is in network, because we do contract at that provider level, not at the system level. So there could be a provider here and there that may not be covered. If you have any questions or you're seeing someone that's not covered, reach out and we can double check and confirm whether or not that provider is going to be in network. You can find your providers by going to anthem.com. So you're going to want to register. If there's anything I can tell you, it's that I want you to register at anthem.com if you're going online, or download the Sydney app, the Sydney Health app, on your phone. So if you go to the next page, it talks about connecting with care that's right for you. So our Sydney app is your one-stop shop for everything Anthem. It's a very comprehensive app that has, it's an artificial intelligence, so the more that you use the app, the more it's going to be personalized to you and your medical needs and your health history and things like that. So you can go to Sydney, the Sydney app, or anthem.com, it's the same information, and find care. So you can look for a provider that's going to be in your network. Once you register with your ID card, it will know what plan you have, it will know the doctors that are going to be in your plan. You can also make cost comparisons for different procedures or medications for different pharmacies. So definitely use the Sydney app. It's really available all the time. I use it a lot. You can see where you are in terms of your deductible, how far you have to go to meet your deductible. You can see your explanation of benefits. Your EOBs are out there. All of your claims are listed out there, whether they've been paid or not. You can make a payment directly through the app. You can link a checking account or a savings account, and you can make your payments directly through that app. And there are lots of other things that you can do there. We're going to get into some of those other things too. On the next page, it does talk about finding the care. We talked about that. Virtual care is really becoming more and more popular now through COVID, when it was difficult to get in to see a physician. Going in and doing a virtual visit got very popular. We highly recommend that you do that. It takes a lot less time. It's very convenient, and there are a lot of things that you can do online virtually that you haven't been able to do in the past. So Live Health Online is our preferred provider for virtual visits. You can get registered and get set up in that. Not only do they do medical visits, but now Live Health Online also does behavioral health visits as well. And if you've tried to make any behavioral health visits, it can take months to get an appointment. You can see a psychologist within a couple of days, and you can see a certified psychiatrist within a couple of weeks. So they can get prescriptions to you and things like that. The other thing that I want to talk to you about is your EAP. So all of Anthem's plans in 2022 do come with a basic EAP plan that's available to you. So what that includes, really entails, is some counseling sessions. So if you have any issues in your family or anyone in your household, so it doesn't even have to be someone that's on your medical plan, but if they live in your household, they are entitled to the EAP benefits as well. So it's 3 visits, either in person or virtually, for each issue that presents itself. So it's not, and that's per person, per issue, per household. So it really is a broad benefit that you can use, and something that more and more people are, again, taking advantage of through the last couple of years. There are a couple other things. There's a free financial consultation and a legal consultation that's involved in that, and some ID and ID recovery and dependent care and living resources. The next thing I want to talk about, and this is on page 34, so I want to just call your attention to this. And this is something new, again, for Anthem in the last year. We have added a wellness plan with all of our medical plans, and it's a built-in benefit that you can earn up to $200 per year for you and your spouse if they're enrolled in the plan, by doing some of these activities. So a lot of these are going to be claims-based, and those are your preventive care measures. So if you go in and you have some like a colonoscopy for an age-related mammogram for women. So if you have some of these, they're claims-based. You don't have to do anything. Once the claim is submitted, you automatically receive the dollars for that. So this chart just kind of talks about the different ways you can earn that $200, and what it's going to be. So that first section, those are going to be automatic. The condition management programs, once you complete the program, then you'll earn the benefit. And for the digital wellness activities, again, those are going to be at anthem.com or through the Sydney app. You can earn those benefits or those wellness dollars by completing some of those activities. How do you redeem them? You also can redeem them at anthem.com or on the Sydney app. And basically what it's going to be is we have virtual gift cards. I can't remember all of them. There are, I think, about 8. So there's a MasterCard, digital MasterCard, Amazon gift card, Target, Home Depot, TJ Maxx, Bed Bath & Beyond, and I think there might be one more. So you can go in on your app, through your rewards, and not only see where you're at in terms of what you've earned, but you can select which digital e-card you want. The other thing Tony talked about a little bit is that, with this being an HSA, or I'm sorry, I'm going to talk about the preventive benefits too. So again, we do recommend that everybody go in for their regular preventive benefits and take advantage of those. So those are like your annual physical, some of the things like I mentioned, those screenings that you can have done. Those are all going to be covered at 100%, as long as they're a preventative visit. So make sure that you're doing those screenings and taking care of the benefits that you have, because going in and having these screenings can prevent future illnesses and more claims down the road for you. On the next page, on page 39, this is your preventive drug list. This is going to be your $0 to low dollar preventive drugs. So take a look at that. And I do want to just direct you to page 6. And this is where you're going to find your pharmacy formulary, your prescription drug formulary. So if you guys are putting this on your intranet site, and it's a digital copy of the booklet, you can just click on that link and it will take you right to the formulary. Otherwise, you can put it into your browser and find it that way. So that preventive drug list is for our essential formulary, and that is yours. And then with your medications, we do have a tiered pharmacy network. So there are 2 levels of pharmacy. The first level is our preferred pharmacy. That's going to include things like CVS, Target, Costco, Sam's Club, Walmart. All of those are going to be a level 1 pharmacy. They're in network, they are preferred, so your cost for obtaining medications is going to be lower. Okay, the level 2 pharmacy is just a non-preferred, it's still in network. The drugs are just going to be a little bit more. So for the tier 1 to tier 3 drugs, it's going to be $10 more per prescription. When you get into the specialty medications, it's going to be 25%, and they're both 25%, but with the preferred tier 1 or level 1 pharmacy, it's up to a max of $350, and then with the level 2 pharmacy, it's going to be a max of $450. Really, the two in this area that you're going to see that are going to be level 2 pharmacies are Walgreens and Meijer. Okay, those are the big ones. Everything else is mostly going to be in that level 1 pharmacy. Last thing I want to talk about, well, there's 2 more things. Just where to get care. Take a look at this and make sure that you're being a good consumer of your health care, because there are different places that you can go and really get more cost-effective and high-quality health care rather than visiting an emergency room, for example. If it's something like a pink eye or an ear infection, you don't need to bring your kids into the emergency room. You could actually do a virtual visit at home in the middle of the night and have it taken care of. So just take a look at this, and it really kind of compares, what the average cost is of each level of care. And gives you an idea of where you can go to find service at for different types of symptoms that you're having. The last thing, this is my last thing, is on page 44. These are just some special offers that just by having your Anthem plan, you are entitled to. There are things like discounts on glasses, hearing aids, things like that. Some fitness offers that are here, and then for your family and home, fertility, like some fertility medications, allergy type programs, and things that are going to be available to you. So these are found on theanthem.com under discounts, and you can see how to obtain all of those there. I think I stayed within my 10 minutes, I don't know. So I'm going to give this back to Tony and let him wrap things up.
So I just want to circle back. Get your preventative care. That's no cost and all of that stuff. The other thing to keep in mind, I know this is an HSA qualified plan. So with that, I mean, it's for people that maybe have previously had a copay plan or something like that, is that everything counts towards that deductible. So when you go into the doctor, there's not like a copay, even on the prescriptions that she said, there's a little bit higher cost for using, tier 1 versus tier 2, but everything still goes towards that deductibles, right? So it's an HSA qualified plan. So when you go in and it's a $300 office visit, you'll get discounts, maybe it ends up being $180 or $200. That $200 will count towards your deductible. You would pay that, and then it would, go towards the deductible. And after you hit that deductible, then the HRA kicks in, right? So it's an HSA qualified plan, so everything counts towards that. So you can utilize the preventative care to be covered 100%. You can use the live online to have lower office visits, so it saves you money to use those benefits, right? The other thing that's with an HSA qualified plan is who in the room has an HSA set up, health savings account? Anyone have an HSA set up? So only a few. So I mean, this is a major, major, major tax benefit that you guys have that you're able to do because of the benefit that EH Wolf is providing you. So what is an HSA? An HSA basically is an account that you can set up. You can go to a local bank. We actually have what's called an invested HSA product that you can set up. Where basically it's the same notion, no matter where you go. It's basically you can set up that account, put money in there pre-tax, and that money rolls over year after year if you don't use it. Okay, so it goes in there pre-tax, but you can also, so if you don't use it, it rolls over year after year. But if, let's say you had a medical bill, a dental bill, a prescription bill, an office visit bill, you can use it the next day to pay for those benefits, those visits pre-tax. So it goes in pre-tax, you can use it the next day to pay it tax-free. So if you have any sort of medical bills, medical, dental, vision, prescription bills, you are literally wasting money by not setting up a health savings account, because it goes in there pre-tax, it rolls over tax-free, and if you use it for bills, it's tax-free. The whole other option that we're going to be turning on is you have the ability to set up an invested HSA. So think of an HSA as it goes into a bank, doesn't earn a lot of interest, but you get that tax benefit right away when you go to your bank and set it up. Now they're not doing it out of their checks right now. but you can go and set one up and still put money in there and then get your deduction at the end of the year. So when you just tell when you file your taxes, it will literally have a line item saying, how much did you contribute to your HSA? If you put $1,000 in there, you will literally get an above the line deduction for $1,000. You'll get your taxes back, $300, right? $200, $250, whatever your tax bracket is, back at the end of the year on taxes, just for putting it in there and paying your bills out of that account. Now that invested HSA is, we've got a product that it basically, it's got a banking side where you can use it right away for like a debit card and checkbook, or if you're not going to use it, you want the deduction and just let it roll over, we have the option to invest the funds in, we have 5 buckets of allocation based on how aggressive or non-aggressive you want to get with your money. And it rolls over year after year, so the interest also rolls over year after year as well. So that those more aggressive ones have been earning more than 24% a year on that invested product. So we have 3,000 people in that product already. So if you want to learn more about that, we're going to have a video as well on your vault explaining more about the advanced HSA strategies for you to watch as well. But if you're not setting up an HSA, you need to set one up. It doesn't matter that they're not doing it out of your check. You can still do it personally. Set it up and just get your deductions at the end of the year. Okay. The other benefits that we're going to be changing are the dental and vision. So we are going to be moving. We're moving to Delta Dental and then also Delta Vision. So the Delta Dental side of things, you'll see that on the sheet there's 2 different tiers. There's a PPO dentist, and then there's a Premier out-of-network dentist. Your dentist will know if they're a PPO dentist or if they're Premier or not contracted with Delta. But basically a PPO dentist, like I use a PPO dentist, my wife uses a Premier dentist. So on this sheet here it says like a PPO dentist, I get an annual max of $1,500. My cleanings are covered 100% and my cleaning every 6 months. X-rays, the bite wings, all that stuff is covered 100%. No deductible, any of that stuff. And then if I need it, since I go to a PPO dentist, if I needed something basic done like a filling, it's covered at 80%. After deductible, major like a crown is covered at 50%. So there's deductibles on basic and major. One of the differences with between what we had previously for dental and this one is there's orthodontics coverage, 70% up to a $1,500 lifetime annual max, and that includes adult ortho and children ortho. Okay, so if you're an adult, you want to get orthodontics, we have coverage for it now. That's a huge benefit that we are adding for that. PPO dentist is 70% to $1,500 lifetime max. So it's a lifetime for orthodontics. It's an annual max on everything else. So what's nice with this plan is that preventative care doesn't count against that $1,500 annual max. It's in addition to the $1,500 annual max. So if you have $500 in cleanings and x-rays, you still get an additional $1,500 to use for like fillings and crowns and that sort of stuff. Okay. Now if you're using a Premier dentist or out-of-network dentist, you would get $1,000 annual max, 80% of your cleanings, 50% of basic, and 40% of major. So it's a little bit different coverage, and orthodontics coverage is 50% to a $1,000 lifetime annual max. Okay, so it's a little bit different. Yep.
What about for dentures?
Dentures, there'll be that more than likely is going to fall under the major services, so a $1,500 annual max for dentures.
I understand that, but I mean, so how much do they pay anything? I mean, they
15 probably cover up to $1,500.
Up to $1,500 for 50%, or
so they'll cover 50% up to $1,500. Yep. So you have to, that's more likely what they'll cover in an annual basis. So, you could. I had some people is you have, a crown one year and you can do another crown, and the next year you could split them and get the 2 annual maxes there. There's also no pre-existing on this plan, so if you need something done, you sign up, you can have it basically done on the dental side of things as well. So good question. He was asking about denture side of things. So to search dentists, so you do have an incentive to go to a PPO dentist. You can go to wherever you want, but you do have an incentive to go to a PPO dentist. DeltaDentalWI.com. Search providers, do cost estimators on what is what. View your claims, all of that stuff. Okay, so dental insurance, cleaning every 6 months for each person on the plan. Now those benefits are for each person on your plan. So if it's you and your spouse, you each get a $1,500 annual max, and you each get 2 cleanings every 6 months. Okay, so that's That's how the dental works. And those benefits also reload on January 1st. Okay, so you can use the annual max this year, reloads January 1st next year. Okay, now the vision side of things.
I have a question for you now.
Yep.
So what if you already used part of your, right now we have $1,000? We already used part of our $1,000.
You get a whole new benefit.
So we had another 15 on,
From June 1st until January 1st, you get a whole other benefit with
Right.
Delta. The question was, what if you've already used some of it? That also goes, it's a great question also with the Anthem piece, is that, let's say any of you have used any of your deductible from January until June 1st, and now we're switching to Anthem on June 1st, we will get a deductible credit report from WPS, and whatever you hit, let's say you hit $1,000 towards your Anthem deductible. You will start with $1,000 towards Anthem's deductible. But it does, just keep in mind that does take a little bit of time. It's probably takes about a month after we switch to get that report, because we don't pull that report until June 1st, because if we pulled it now, you're still going to have claims. You're going to want all your claims credited, right? So we can't pull it, and then there's a time delay to get it all in there. So we just keep in mind that deductible report does come over. But dental, you get a brand new annual max. Orthodontics is brand new, and all that starts over, on June 1st. Okay. Vision insurance, same thing. You get all these benefits starting, as of June 1st. The only difference with vision is its frequency is based on a date of service, not calendar year. So that means that, let's say you use your frame allowance, on June 2nd. You have to wait until June 2nd or later next year to use that frame allowance again. Okay, so that one's not a January 1st. The vision is based on date of service. So that one, it's 100. This is a very, very good vision plan. Everything's a 12-12-12, which means that you can use your benefits every single year. So like a frame allowance or contact allowance, it's one of the two. It's $150 towards that every year. That's a really good vision plan. Then the copay for an exam, it's a $10 copay. Then the insurance will pay the rest for an optometry visit, and it's a $10 copay for standard lenses, plastic lenses, and then the vision pays the rest after the $10 copay. Now, one thing with the standard plastic lenses, let's say you want anti-reflective coating, resistant, like higher quality than the standard plastic lenses. There's a little bit higher copay. I think it can be up to $75. There's different categories, but up to a little bit higher copay on the standard plastic lenses. Okay, so frequency is 12-12-12, and it's also based on date of service. So you can use those benefits every single year, which is not common. A lot of times it's every 24 months for frames. To search providers on that, you go to deltadentalwi.com and you click on the Insight Network. That's their broadest network. You use the Insight Network for the vision as well. Now, the main thing with the vision is no Sam's Club, Walmart, or Costco. Those three are not in the vision. You could go there and it'll be a manual submission for you to get. It's not going to be this coverage. They'll maybe cover up to $40 for a visit or up to this. It's a manual submission. So I always say with this vision, try to stay away from Walmart, Sam's Club, and Costco. Just so you have Shopko Optical, there's LensCrafters Pearl Vision, Sears. There's a lot of the smaller optometry clinics are in there. It's just no Sam's Club, Walmart, or Costco. The other benefits on the back, we are not changing anything with the United Healthcare Life or short-term disability. So we do have a company-paid $25,000 life and accidental death and dismemberment. So if you were to pass away, your family will get $25,000 if you die in the AD&D. What that is accidental death and dismemberment. If you were to die in an accident, it does double, so it'd be $50,000, or maybe there's some type of dismemberment where you lost a limb or eyesight. There'll be a percentage of that $25,000 that you could tap into before, without even actually passing away. So there's a benefit there that will pay to you and your family. The life insurance, you can also buy up to $500,000 additional life insurance through the group, increments of $10,000, but you can't exceed more than 5 times your annual earnings. And once you turn 65, there's a little bit of a reduction, so it's not the full amount that you can get. Now, let's say you were not on this previously, or you now want to get $200,000 of life insurance. There will be what's called an EOI, an evidence of insurability, that you're going to have to fill out to verify health. At this one, you do need to qualify for if you're going to add new. Now, if you're a new employee, there's a guaranteed issue amount that you can get. I believe it was $50,000 to get the exact amount. But you'll have to do an evidence of insurability to verify that you can qualify for higher. You can also get it for your spouse. They can get half of what you get, or dependent children can get up to $10,000 that you can get as well. The short-term disability plan pays $1,000 per week, so it's basically 60% of your income is covered up to $1,000 a week. And that one, this is a pretty good one that pays day one after injuries, or on the 8th day for sicknesses. So if you fell from a ladder and broke your leg, for example, that's an injury, you start getting your income paid right away. Now, if you were to, your knee, you just had, over time, your knee was wearing down and you needed to get knee surgery, that's different. That is an illness or a sickness, so there'll be a week waiting period, then it'll start paying 60% of your income up to $1,000 a week for 26 weeks. Okay, so now Adam, if you want to come up here, they, through Colonial, if you say, hey, I want to get more than that, or I want to have longer benefit than the 26 weeks, Adam does have a disability that he'll talk about. He could extend that. So I'll have Adam talk about the voluntary benefits. He's kind of couple around the health insurance. Maybe you can put some money towards, that deductible. And then after Adam's done, we've got Trio Wellness and their team that's going to talk through the wellness side of things.
All right. Name's Adam from Colonial. I'm going to go through this packet. It's kind of a little paper packet here. You can pull that out. I'm going to start with the confidential worksheet that's on the top. So what's going to happen here is I'm going to actually schedule Holly a day to come out here one-on-one and discuss this. If you would like to do a one-on-one meeting with me to discuss these other options, or if you do have questions, I will have my card that you can ask me personal questions outside the meeting for any of these plans. But if you want, before the end of the meeting, if you could just fill out these basic informations of the things that you would be interested in. This does not obligate you for coverage, but this just gives us an idea of what I'm talking about when I do schedule a date to be out here on site to go over these options and make sure that we have everything listed that you would like moving forward for this year for June 1st. Okay? All right. So Tony talked about here the disability. So you do have the short-term disability option that's available up to the 6 months. We're going to be up to a 2-year benefit past that 6 months that you can choose up to 60% of your income on. So it is $100 increments. So let's just say you want something to at least cover your bills and expenses. You can choose in $100 increments what amount you would want for that disability option. Okay? Further along the back in the packet, there is rate sheets that include the rates of what it would be for a disability plan for that 24-month option. There is 2 age brackets on it. It looks like this, to simplified. Okay? And I just put in some different examples at $1,000 a month, $1,500 a month, $1,800, $2,000, $2,200, and so forth. Okay? These are rate examples. Again, you can go anywhere in between that, lower, higher, up to that 60th percentile. Okay? Once you elect this, so let's just say you're in bracket 17 through 49. Once you elect this, you are locked in with that rate. That rate does not change. So if you're 49 and you're about to turn 50, say in October, you're going to be locked in at that 49 rate. That rate will never increase based on your amount that you choose. Okay? All right, and that's for 2 years from the 6-month date. So after 26 weeks, it pays for 2 years beyond that point. Okay? I'm going to hope that happens to nobody, but if it does happen, it's there to help cover your bills and protect your paycheck. Okay, very most important. All right, questions on that so far? Okay, the rest of the plans I'm going to talk about are for your copays, deductibles, your out-of-pocket maximums. Okay, these are ways that you can help fund or cover those, or in some cases above and beyond that, use the cash to cover those expenses. Okay, the first one and the most popular one that I talk about is the accident policy. Okay, I'm going to go to this one. It looks like this. It's a bifold brochure. On the inside there's a flyer, so just be careful, it might fly out on you. But the accident plan is pretty self-explanatory. It's for accidents outside of work. Okay? So if you have kids are covered up to age 26, regardless if they're in or out of the house. If you pay for 1, you pay for 10. Okay? As far as how that works is basically, it's a set amount, and the more severe of your injury, the more money you can get off the plan. Okay? So what happens is, there's some gentlemen in here, if you hunt, you fish, you play sports, you have kids, you're physically active outside of work, let's just say that you were to go in for an accidental injury and get stitches, okay? What's going to happen on the inside of the brochure there on the top left, it's going to say accident emergency treatment, okay? That's the minimum that you get, and then it's a checklist. The more severe of that injury, the more money you can get on that plan. So for example, the stitches, let's just say you had an x-ray, there's an x-ray benefit there, lacerations about 3/4 of the way down the page, and you're probably going to get a follow-up visit on the other side to get them out, okay? So it's going to trigger different parts of the plan depending on obviously what you have happen, okay? So, and that's any medical profession. You'll see on the accident emergency treatment, that's for the emergency room, urgent care, or a physician's office. Obviously, be a smart consumer and choose obviously where you should go. If you have an opportunity to go to a physician's office, it's going to cost you a lot less than going to an ER, okay? But obviously, if something were to come up, let's just say you pull a muscle or tweak something in your back, you're lifting something heavy at home, you end up going in for a, let's just say a physical therapy visit or going to a chiropractor, okay? You're going to see therapy on the right-hand side there. It's $40 per day. That would help cover your visit, okay? That's not going to cover you for a maintenance visit, though, okay? If you have to go in, it has to be the result of an accident, okay? So if you wake up the next morning and you're just sore as could be and you could barely get out of bed, you're going to want to think about, hey, what happened to me that night before that I was doing, and making sure that, hey, was this as a result of an accident, or was this just because, I'm getting old, or whatever it might be, okay? So as far as that goes, there's lots of different bells and whistles. There is accidental death included in on that. And again, if you do have somebody, or if you are on the plan now, that insert in that flyer that was in there, okay, there is a wellness benefit that you can have either attached or not attached for $50 or $100 reimbursement, okay? So what happens if you don't have an accident over the course of the year? All right, this is a standard wellness assistance program. So what this is the ladies that go in for a pap or a mammogram, or let's just say you go in for a blood test or a physical each year and you get a full blood panel done. There's 26 different tests that are included in on that wellness exam. So if you choose 50, it's going to be $50 per covered person on the plan, okay? So what that means is if you cover you, your spouse, and your kids, you're each eligible for this benefit, okay? Everything starts as of June 1st. There is a 30-day wait portion on just this part of the plan, okay? What that means is if you do have something in June, if you can kick it back, obviously do what you have to do, but if you can kick it back, you'll get that reimbursement off that plan, okay? If you choose the $50 versus the $100, you pay a little bit more. You pay about $22 to get the $50 and about $46 to get the $100, okay? And when that happens then, the simple part of it in claiming is you just need the doctor's name and phone number of the place that you went to and the date of the test. You can do it right online. It's a drop-down menu, okay? You select the test and it's direct deposit in your account if you choose it that way. Otherwise, it's filed that same day, check sent out from South Carolina to your home, okay? Just cash it like you would with a normal check, okay? Questions on that? All right, so I get questions, well, what if it's not an accident? All right, what if it's a wear and tear event, or a doctor told me 10 years ago I'm gonna have to have my hip done, or a shoulder rotator cuff, or maybe you have a health condition that you're concerned about, okay, where you might have to have a scan or surgery or outpatient or inpatient. The next plan is the hospital plan. All right, this is a one-sheet flyer. It's got the front and back on it. I'm going to go over that. All right, kids and spouse can be covered under this plan. And this is regardless if you take the health plan through here. So let's just say you offer it and you take it through your spouse or you take it through E.H. Wolf. You are eligible for these options and you can cover spouses, dependents, regardless of what insurance plan they're on. Okay, it doesn't coordinate. So on the hospital plan, this is accident or illness, or wear and tear. In that case, it's classified as a sickness. You're going to see the hospital confinement benefits. You actually have two different levels that you can choose from on there. It's a $500 or $1,500 hospital confinement benefit. Diagnostic procedures, you'll see observation room and outpatient surgery. So your outpatient surgery benefits there on the blank if you want to fill those in. That's $750 and $1,500 for Tier 1, $750, $1,500 for Tier 2, with a maximum of $2,500. Okay, so to give you an example, let's just say somebody wants to go in for a rotator cuff or knee or hip replacement. Okay, you may have a diagnostic procedure where they do a CT or an MRI, make sure that, hey, this is what we're going to do before we go under the knife. And then the outpatient Tier 1 and Tier 2 surgeries, there's some examples listed on the back. Okay, Under a knee or a shoulder rotator cuff, that's going to be a tier 2 benefit, okay? So if you go in for that type of thing, or let's just say after June 1st, you go in and you're going to have that scan or that particular procedure, that's going to be a $1,500 benefit and a $500 diagnostic, okay? So you're getting a $2,000 check reimbursement to help cover those copays and deductibles, all right? It is also great for planning kids if you are at the child-bearing ages. On the example on the rate sheet on the bottom, I put in, there's a Plan 3 and a Plan 1. The Plan 3 covers all the bells and whistles, okay? Plan 1 is the one for the pregnancies or overnight stays. So it's just basically the top portion from the waiver of premium on up, okay? So you pay less for the child-bearing ones to not have the diagnostic and the outpatient surgery included. So it really just depends on what you're utilizing it for, okay? So you'll see on a child-bearing one, an employee, you're paying about $250 a year for a $1,500 benefit, okay? On that one, and then a wear and tear plan, $15.26 biweekly for somebody under 50, 19 over, right around $475 to $500 a year on that, okay? So that kind of gives you an example as what you would make over the top of that if something were to come up. And again, hopefully never. All right. Questions on that so far? I know that was quite a bit quick. Okay. The last two that I go through here is the critical illness portion. You're going to see this one here. It's a flyer that says the cancer, heart attack, stroke portion. Okay. This one's going to be your more major stuff. So you have the accident for accidents only, the hospital for wear and tear or sickness as well as accident, but your bigger ticket items, this is going to be your more major high-risk diagnosis. So what's here is the critical illness is a $5,000 benefit on up to $75,000. You get to pick and choose that option. So if you want an $8,000 benefit, a $10,000, a $20,000, it's age-banded, tobacco, non-tobacco. And then once you're locked in, all these rates are locked in at the rate that you take them out at, okay? So if you're 40 years old now and you elect this benefit, it will be the same rate as when you're 50, okay? As long as you keep it the same, you don't modify or change it, it's included there, all right? All forms of cancer other than skin cancer is included in that option, all right? The rest of them, on down the line, you'll see 100% of the face amount. It does go into bypass surgery and carcinoma on the bottom for 25% of that face amount. So if you choose 10, it's going to be $2,500 for those two options. The rest of them, it doesn't matter if it's stage 1, stage 4, no treatment, a simple surgery, chemo. You choose 10 grand, they're going to pay you 10 grand. Okay? It is subsequent as well. Okay? What that means is basically if, let's just say that you were a previous cancer survivor, okay? What happens then is if it was ever reoccurring or if you have a new form, it pays up to 3 times what you choose. So if you choose 10 grand, your policy is worth 30, okay? Choose 20, your policy is worth 60, and so forth, all right? Your spouse is included in on this, and you can do it as a standalone coverage. You can have a standalone spouse coverage, which would be a $5,000, you would get $5,000. If you choose the employee and spouse option on there, your spouse gets 50% of what you choose, and you can take your age into consideration. So let's just say your spouse is maybe a couple years older than you. It takes your age into consideration on this, okay? So maybe your spouse is younger. You might want to do a standalone coverage because your spouse is going to get a little better rate because based on the age bracket, okay? Your $50 wellness is included in on all these plans, okay? So if you go in for that same list that I had on that accident, that wellness assistance standard, those same tests are covered underneath this as well as the hospital plan, okay? So at any plan you participate in, if you do more than one, you do get the reimbursement for the accident, you would get it for the critical or the hospital, vice versa, okay? Questions on that one? All right, the last one is the life insurance. Tony went through the life insurance options, your guaranteed issue, your buy-up options. So this is just like a standard true term life. So let's just say you want to have something that when you're working here, the life insurance option that's through UHC is going to be your option to choose. It is in different age brackets, so as you get older, your rate could increase. This is going to be one that's locked in like a true term, like you bought it on your own. Okay? It's simplified questions for everybody here because E.H. Wolf is offering this to you. And you'll see the standard terms there, the 10, the 15, 20, and 30-year terms. And you can elect for anybody under 50, there's only one health question that's asked for you. For under 50 up to 50,000. For anybody over 50, it's going to be 29,000. Okay? One simple health question, otherwise nothing up to 150 blood tests or physicals aren't required. Okay? You or a spouse and dependent kids can be covered under this. Okay? All right.
So we got Trio. We have a new wellness partner that we'll talk through some wellness benefits and some coaching that they're going to be able to do for employees. Right here.
All right, thank you for having us. I know you guys all want to get back to work, so we'll try to hustle through this for you. I'm Greg Waters with Trio Wellness. I'm going to take a couple minutes here and explain who we are and how we got in front of you today. Trio is a division of Johnson Health Tech, which is one of the largest fitness equipment manufacturers in the world. We sell over $1 billion of fitness equipment each year, but yet our health costs continue to rise every year. I don't know if you guys have seen that, but even with a staff of passionate fitness freaks, the current system isn't working for us. The current system allows for healthcare costs to continue to rise because of basically bad habits continuing to build over years and years until a doctor has to get involved. So things like hypertension, type 2 diabetes, that cost a lot of money to actually get in there and fix. And it's all completely avoidable. So 5 years ago we reviewed this and we decided that a proactive approach was the best way to go. That basically allowed things to happen that it didn't have to be evasive. So traditional methods, they get in there and they probe and they take blood and do these tests, where a proactive approach is more about taking a quick assessment, grabbing some healthy habits and getting some education to get on top of these things. So we teamed up with Tony and 5G a couple years ago to bring these resources to his clients so that it could help him negotiate and get better pricing for you guys and have better outcomes. So I'm going to introduce Laura to get us started on this. Laura is a health coach. We got her from Prater Hospitals. So you can imagine being a wellness coach for medical professionals is pretty intense. And she's able to do that for the past decade, actually. She's going to walk us through the sign-up phase. And since she already handed out the green balls, that goes to people that actually sign up today. So I guess you guys are all signing up today.
We're all signing up today.
So Laura, can you get us started on this?
Yeah,
All right.
absolutely.
Thank you.
All right, so
The clicker?
I do. It's in my
Awesome.
pocket. I move around, so the camera's not going to be great for me. So I'm Laura Kugleig. I am the Trio Wellness Account Manager and Wellness Coach. So a little bit about me. I come from Freighter Medical College. So driving up here this morning, I used to go to Hartford Clinic. So there's the Piggly Wiggly, and it was kind of fun. A little blast from the past. But I come from Freighter, where I was the health coach for about 12 years. So I worked with all the employees. And then I was with Milwaukee County for about 2 years as the wellness coordinator, working with the employees as well and their benefits plan and program. So I have a bachelor's in kinesiology, a master's in health and wellness management, and I have a background in personal training, health coaching, behavior change, resiliency coaching, compassion fatigue, and I think that's about it. I've been an instructor for Pilates, plyo, strength and conditioning, indoor cycle. So yes, I am your coach, and I'm excited to work with you guys all with Trio. So to get started, Trio is the most personalized wellness solution on the market today. So you do have access to the digital health tools and the virtual coach right here. So we'll get started. And to kick it off, I put this slide in here. I want you to start thinking about your health goal. So think about the health goal that matters most to you right here, right now. that health goal you select will determine the content that is loaded into your software, okay? So it could be lasting weight loss, it could be making healthier food choices, better blood pressure, whatever speaks to you, that's the goal you will choose as we sign up for the platform here today. So our behavior change model is based on when you eat, and what you do. So these are the customizable habit tiles that are loaded into your software. So for example, if you selected lasting weight loss, you would see the tiles of mealtime spacing, eating occasions, vegetables and fruit, and physical activity. Those small daily habits help you achieve the big goal, that big picture of lasting weight loss. Because that big goal can seem overwhelming, right? So it's the small daily actions and these small daily motivations that lead to that larger goal. So the cool thing about Trio and everything that we have to offer you and working with myself is these habits are customizable. So you can send me a message, we can schedule a call via Zoom or telephone, and you can say, hey Laura, I'm doing good with physical activity, but I really want to focus on strength building, or I'm really feeling stressed out, can I track my stress? Absolutely, we can work together and we can change that habit tile for you. So let's get started. So bring your smartphone out if you can. You guys have your phones on you? No? Hopefully? If not, that's okay. You have your information in front of you. If you have your phone, I encourage you to sign up today. It'll just be easier as we walk through the process, and then you can be a champion for everybody, and you can help people get started. So your company ID is 1031, and your code is Wolf 2022.
Do they need that QR code first?
The QR code is on your sheet of paper, your handout. If you could scan that QR code. I know I'm trying to get you guys through this.
I don't have it. I see a QR code on there.
Just go back a page. Just go back a slide. You can QR code off the
Can you QR code off the screen? If not, there's the QR code on the handout. It's not being recorded, so I can walk around. I am a fitness instructor after all, so I can't stay still in one spot.
That's why we don't trust you. Yeah. I got his email address, mine or somebody else's.
Your email address, so, yeah. Yep. Register as a new user at the top of the page. Fill out the information, last name, first name, phone, create your password. Get logged in. Once you fill that out, you will go ahead and start your assessment.
Have the password.
Password is, you have to create your own password.
Oh, too much work.
Too much work. Brewers 2022 is a common one I like to use. Just kidding, guys.
Then I gotta remember it. I'm supposed to use the same one I use everywhere else, am I? Password.
It's a word pass, 1, 2, 3, 4. It's a good one.
I mean, it's nothing, into any of my personal stuff, so I can just put password down.
You can put whatever, you want. Everything is confidential, so
Oh, yeah.
I just get the aggregate results.
That's sure, that's what they all say. Don't get in jail.
I'm the best coach you ever need. So this is also, as you guys are signing in, a little fun fact about myself. I am the youngest of 11. So I have 10 older siblings and 23 nieces and nephews. So, who all call me every single night. So I think I can handle. Actually, if you guys want 10 siblings, take them. I'll take the kids. You can have my brothers and sisters. All right, are you all loaded in?
Try to answer. I didn't get that part. No, I turned on that. Yeah.
Working on it? Oh, perfect. Yep, so your account will get ready, and then when you are at that screen, please hit Start Your Assessment. When you start your assessment, that health goal pops up. So that slide I showed you in the first about what health goal resonates with you, select that health goal, because that health goal determines that content in your software, and those habit tiles are selected. And I'll be quiet, I promise, for 2 minutes.
Name wrong. It doesn't tell you what to email or password. My email's right, so I made my password, but that was not right either. How can it be easy? I had it in there before. Try this again. Now. I'll use this.
Pass the camera.
You gave up. I gave up.
You can do it later.
Yeah. I'd probably never look at it anyway, so that's my problem.
It's all good stuff.
It probably is, because
It's all good, interesting things.
I never got that far, sorry.
Were you having trouble? Oh, we have to get started. And then it's 10:41. And then, yep, 10:31 is the last code, and then Wolf 22. All right, so as you finish your assessment, you can go ahead and click View Digital Report. As you view your digital report, there is a snapshot. This snapshot is essentially showing where you're doing well and what may need improvement on. So as you scroll through, you'll see your health goal and the health goal you've selected. So in this example, it's more energy and less stress. And then as you continue to scroll and click next, you will see your habit tiles that are associated with the health goal that you've selected. So in this example, for increased daily energy, it's physical activity, stress release, sleep, and vegetables and fruit. So as you scroll through, you can read this, you can come back to this. It's the research and the education that is behind those health tiles and why those health tiles were selected for that specific health goal. Remember, that health goal is an overarching goal, so we are focusing on those daily small habits to achieve your bigger goal that you want to achieve. So then it walks you through a virtual tour. That virtual tour, will walk through the significance of Trio on our dashboard, and I'll walk you through everything. So as you click next, you can go through. Just by opening up the Trio dashboard, you get 50 points. And so as we practice tracking your habit, you will earn that point total will increase based on how you track, but just for opening up the dashboard, you get 50 points. So as you click through next, you're going to go into the habit builder, and this is where you will practice logging a tile. So in this example, physical activity is the first one. You're going to click on next, and then you're going to click on the log button, and then there is that green, yellow, red, and this is the logging screen. Again, red is no points are awarded, yellow is some points, green is full points are awarded. So ideally, we would like you to track in the green, but sometimes we're just not there, and that's completely okay. But it's that goal that you set for yourself each day for that specific habit tile. As you click next, and then you would log your progress, and then you will see your score change based on what you tracked for that tile. And then at the top, there is a question mark. That question mark will bring you to more content from the Trio dashboard. So you can review how to log in your habit builder, you can discover your personal pathway, content just for you, so that content, that's video and educational content that is loaded just for you. So if you are an athlete, if you're a woman over 45, under 45, you can add that specific content and learn more that applies to you. So as we go through your Trio pathway, if you were to click into that tile next to your habit builder, this is the education that gives the reason behind that tile, those tiles. So it's a little bit more of that educational resource as to why those tiles were selected. So just a little bit short videos, 3 to 5 minutes, that you can go ahead and look at. And then there is more energy, less rest in this example. You may have something else. And then that content of just for you. And then as you scroll through the Trio dashboard, you get to see tiles such as Relax and Restore, and Better Sleep, and Mindfulness. And I could talk to you guys for the next hour about how great this is because, you know, I'm your wellness coach and I love it. Just because as you look through, Relax and Restore is all about breathing and learning the fundamentals of breathing. And typically we don't, I'll take a deep breath right now, right? Typically we hold our breath. Typically we keep our shoulders up to our ears. We may be stressed throughout the day. Just a simple deep breath can really just help relax our nervous system and make us feel good. So Relax and Restore is all about the breathing. If you hit the 5G logo at the top and you go back to your homepage or your dashboard, you can click into the Better Sleep tile. Better Sleep are sleep sounds, so to help you relax at night, to help you, get to sleep. If you're awake at 2 o'clock in the morning and you can't go back to sleep, you can play one of your Better Sleep tiles and you can, relax. Or if you're winding down for the night and you just need that, that sound in the background, Ocean Surf is one of my favorites, so you can play, or Soothing Surf. You can play Soothing Surf and pretend you're on a beach when it's 43 degrees on April 29th. So, Better Sleep tile. And then Mindfulness. It just brings awareness to mindfulness. So there's body scans and inspirational sounds that you can learn and educate yourself. Again, these are free, fun resources that are there for you to help you just live a better, healthier life. And then if you scroll down, there is cooking video, so at home, at work, and on the go. Jill, our registered dietitian, has done the videos with the recipes that, again, you have access to. So take a look at all these videos, learn a new recipe, try a new recipe. And then there is on-demand classes, so Fit on demand, as well as virtual active. So if you have a bike at home or elliptical or a treadmill or you're at the gym, you can go ahead and go to New Zealand, or you can go to Washington. Again, see the bright, sunny views, because can you guys tell I'm kind of sick of this weather? Anyone else sick of this weather?
Love it.
So you can go ahead and do that. And then there's Fit on demand, free resource that links out. Yoga with Adrienne, another free resource that links out for you guys. So just some really great resources that you have access to as a Trio member. Any question? I think I made it in time, not too bad.